I'm seeing lots of patients like Michelle, women in their 20s or 30s that are still struggling with acne. We refer to this scenario as acne tarda, which is where we're seeing a lot more patients that are keeping their teenage acne into adulthood or developing it for the first time in young adulthood rather than in puberty. And it's fairly common, much more common in women than in men, and we theorise a lot of reasons. We think it's probably a mixture of things like dietary changes. Generally, diets become worse, sort of reproductive choices, cosmetic practices. But I'm seeing lots of patients like Michelle, women in their 20s or 30s that are still struggling with acne.
Wow.
What can she do?
Yeah.
So the treatment's actually very similar to conventional teenage acne. So teenage acne we refer to as acne vulgaris, just meaning common acne. And the treatments are largely the same. So, you want good skincare practices, you want to avoid things that you know are going to trigger them. So heavy makeup, not taking makeup off, smoking, bad diet. But from a medical point of view, we sort of have a bit of a ladder where we treat it proportionately to how severe your acne is.
She was saying, by the time I get to my 30s, this must be gone.
Yes.
Is that going to happen?
Not necessarily, I'm afraid. So it does vary from person to person, and it's true that the older you get, the more likely you are to clear your acne. But some women, unfortunately, really do keep it right the way through till menopause.
Wow. You shouldn't have pimples and wrinkles. I mean, seriously.
It's not that common, at least. But yeah, and as I was saying, there's lots of treatments available. So from creams, topical astringent agents, things to dry out some of that excessive oil to break the cycle. We use oral tablets like antibiotics or hormonal tablets like the contraceptive pill or spironolactone. And then, of course, the drug that everyone's heard of, which is the oral retinoid tablet called isotretinoin, which is commonly known as Roaccutane, which is probably currently our most effective treatment. And interesting, last year, for the first time, we actually had a laser launched to treat acne.
Can you treat acne scars?
Yes, they're very treatable, and again, it depends on the type of scar. The hardest ones, obviously, the ones that bother people the most are the textural scars left over, sort of pit marks, and if they're superficial, you can treat them with microneedling or chemical peels, but if they're a bit more deep, they usually require some form of laser resurfacing.